So, our panel, Digitizing Population Health. We'll get into some really interesting topics as we go through this, but introducing the panel. So Eric Talbot is the Chief Strategy Officer for Medfuse. With over 20 years of experience as a healthcare consulting and strategic marketing leader, Eric Talbot is a seasoned professional known for blending analytics and marketing expertise in the healthcare sector. Currently serving as the Chief Strategy Officer at Medfuse, Eric leads the development of cutting-edge solutions to real-world claims data and delivering actionable insights, ultimately enhancing commercial success. Prior to joining Medfuse, Eric held prominent positions including leading strategy and insights teams at PatientPoint and Univision. Throughout his career, he has consistently delivered business, critical insights, and influenced market perceptions, contributing significantly to revenue growth for both his companies and clients. Welcome, Eric. Kevin Ungi is the VP of U360 Medical. U360 Medical is a specialist product communications agency that unites the science of medical messaging with the compelling clarity of consumer marketing. Partners with global CPG and pharma companies, we simplify complicated science, products, and technologies to create content that educates, engages, and empowers healthcare consumers. The result is more meaningful healthcare conversations that are proven to drive engagement and better health-related outcomes. In his capacity as Vice President of Product Communications, Kev is fundamental to strategy development and client success, partnering with brands across a range of health, wellness, and personal care products available with and without a prescription. Welcome, Kevin. Nicola Patridge, Director of Digital Healthcare Product Strategy at a small company called IQVIA. Nicola has over 20 years of experience in healthcare. She began her career in UK healthcare policy before joining IQVIA, where she has worked in global strategy consulting, then as chief of staff before moving to the US to lead strategic planning for the commercial business. Since 2022, Nicola has been a driving force in IQVIA's digital business in the US. She leads product and commercial strategy for pharma and agencies and has championed the adoption of AIM XR, IQVIA's digital behavior insights across the industry. Her expertise spans digital marketing, omnichannel, and ad tech. Nicola is a two-time IQVIA CEO Award winner, was named a finalist for the Healthcare Businesswomen's Association Rising Star Award in 2023, and has been recognized on MMM's 2024 Women to Watch list. Nicola is a passionate advocate for diversity, equity, inclusion, and belonging. She drives several DEIB initiatives at IQVIA and is a thought leader on how advanced in data and technology can drive health equity. She volunteers as VP of Corporate Relations for the HBA and dedicates her free time to mentoring and volunteering at St. George's Society of New York, as well as in her alumni groups. Welcome, Nicola. Last but not least, Seth Mellin, Associate Director, Point of Care for Rapport Worldwide. Seth Mellin is Associate Director of Point of Care at Rapport, IPG Media Brand's out-of-home specialist agency. He is currently overseeing the POC team for Bristol-Myers Squibb. In his 15+ years in pharmaceutical advertising and marketing, Seth has proven to be a force within the industry when it comes to delivering strategic recommendations and measurable results. He is viewed as an expert in the electronic health records, EHR space, and is continuously looking for ways to bring innovation to a notoriously traditional environment. His forward-thinking approach to the point of care space has allowed him to become a leading voice on the Point of Care Marketing Association Industry Advisory Council, where he also serves as an active member on the Measurements and Research and Verification and Validation Committees. Seth brings his robust background and passion for producing positive patient outcomes to deliver industry and category leadership. When Seth is not working, he's enjoying nature, cooking a well-crafted beverage, or is at a barbecue event cooking. So the question I have for you, Seth, is it Kansas City, Texas, Carolina, or Memphis?
Oh.
Here you go. Welcome, Seth.
Thanks, Ray. So we're going to be talking about the evolution of digital health, and unfortunately we can't talk about how digital health has exploded without talking about the COVID-19 pandemic, which really did accelerate digital health growth in the US. It changed the way patients are managed and the way that they're treated. We saw a huge rise in the use of telehealth in unprecedented ways, a lot of which have sustained to improve patient care. And we've also seen the rise of virtual primary care appointments, with self-diagnostic kits actually being sent to patients' homes. So we're going to explore how all these changes have impacted the healthcare continuum and the impact it's had on equity, social determinants of health, and how brands and agencies look at this when they're marketing at their HCPs and to the consumers. So let's jump right into this, guys. I think the biggest challenge we have when we're looking at it from an agency perspective and a client perspective is the data. Do we have the right data in this new world to help us make these marketing decisions? And what data is missing? Do we wish we had, and what might be the most important? So Nicola, why don't we start with you?
Of course. So I would say yes, absolutely. I believe that we have the insights that are needed to, inform the most effective marketing posture today. The question is whether brands and agencies are using all of the right data sets and whether they're using them the right way. Now, I think everyone knows, right, our industry is incredibly well versed in using clinical data sets like claims, prescription data, diagnostic data, lab data to inform health marketing. I mean, most target lists, at least on the HCP side, are, if they're not listed as specialties based on reference data, then they're historical prescription or diagnosis data based. And this data is great. IQVIA has a huge amount of business based on clinical data, but it only gives you one facet into the PHCP's activity. It's only giving you one window into the types of patients that they may have in their practice. But what if and actually in many cases, if you think about marketing and the goal of marketing is trying to influence or inform a treatment decision, if you're only acting on prescription data, then you may have missed the boat on being able to influence that decision. What if you had access to the information that HCPs were looking for when they were trying to arrive at that treatment decision? So, they're asking questions about how to understand symptoms that patients presenting with, or how to think about different treatment options that are available for a specific indication. Well, at IQVIA, we have access to this data, and we work with lots of clients who use it in different ways, and it's digital behavior data. So you mentioned in my bio, AIM-XR. It's a technology that enables us to, in a fully consented way, observe the digital research of over 1 million HCPs across over almost 6,000 endemic medical websites. So through this data, we can see what questions HCPs are researching around when they're trying to make treatment decisions. And this data is updated every single day, so you can act on that incredibly quickly. And in my view, the only way you can truly achieve personalized marketing is if you're able to, take all of these data sets that are available, whether it's clinical, claims-based, and also digital behavior, in order to inform those touch points with the HCP. And we have no shortage of evidence that when you really take a personalized approach and layer in that behavioral data to your marketing strategies, your outcomes will be so much better across, script lift, but also engagement, trust, all those types of, all those other ways that you can measure. We heard a lot about measurement in the previous session there. So I would say we have access to it. It's just a question of whether people are using it.
What about you, Eric? I know you.
Yeah, so I'll take it from a slightly different perspective. Rather than the HCP, I kind of gravitate towards the patient. After leaving IMS, I was over at Berespan. We were one of the first companies to start integrating other data sets, and that got me into the whole multicultural space, which is today DEI, or social determinants of health. And I think if we look at how we connect, not just reach, culture becomes really important. And culture is, if anybody's studied Hofstede, there's so many 6 variables, and then he lists out the language, but we have to understand the whole patient, and even the whole patient base of a physician, and the physician, in order to deliver a message that's salient to them. And for that, it's not just the behavioral data, but it's the other attributes that we have. So we have things like race, ethnicity, income, education. Those are all variables that are going to affect how somebody acts and behaves. Just to kind of spoil a little bit of a webinar that I'm doing with Univision next week, we'll talk about the importance of language. Language isn't just about English versus Spanish. It's about words we use. We talked about it at lunch. You had a can of what we call soda in front of him. I said, Kev, you're living in Cincinnati, what's that called? He goes, well, if I was back home, it would be fizzy drink, right? In England. And if it's in Cincinnati, it's pop. You say pop to somebody here in the Northeast, and we're like, what are you talking about, right? So for me, that just is a way of illustrating the importance of understanding with data who it is that you're communicating with.
Yeah, very, very good. So Kevin, I know you don't have the data background of that, neither do I. You're the brightest data minds that I've ever spoken
I definitely
with.
didn't win any awards for data.
But, this acceleration of digital health, right, it's really helped the management of consumers and delivery. When we think about that, of this data overall, what's had the biggest impact in helping us as marketers, as agency people, make the recommendations? How does it all come together?
I think for me, where I believe, and where we do leverage data every day, is more on the insights piece than the actual numbers itself. And that's diving into it and really observing and watching what is happening. So I try not to think of data always in the context of numbers, but in the qualitative portion of it too, which can leverage some of those observational points that you mentioned earlier on. And then the other thing I would build into that too is, you mentioned not being able to use the data as an agency partner. Goes way over our head, and what all of our other partners are doing, what they are telling us, differs depending on who you're working with. And one of the things that we are finding very useful at the moment, that we found companies who are coming with integrated dashboards, and so they're all talking to each other, and then they're allowing us as the creative idiots who can't count to really understand how we can best tell those messages.
So I want to jump into something. So integrated dashboards. Now, when you say an integrated dashboard, you're looking at one that's pulling data from multiple partners, or just from the one partner that's just showing you everything that's happening?
It depends who the partner is and what information they're going to give us. Ideally, though, we have our custom created dashboards, which then get fed by all the different places that we're putting the investments in.
Now, this jumps into the next one for all of you, whoever wants to jump first, But we have this data, we have these dashboards, right? We're really using digital healthcare. We're trying to get to that personalization of it. It changed the way we market to the patients and the HCPs. So what do we use that data? What does it mean to the consumer? When we're able to take this and put all this data together and get down to that next level of personalization. Who wants to grab that first?
I'll get in with that.
Go for it, Kevin.
For me, I get really excited by this, because what we're able to do is talk to people on a personal level and tell them wherever they are, whether they are experienced with this condition that they may have, or whether it's brand new to them, we're able to connect and help them. And that's really where I get excited by it, because the idea of saying one thing and saying it everywhere was completely in the past now. We don't have to do that anymore. And to be able to have those personal connections and build those relationships really puts you in a different position as a marketer when you're making and building improvements to that health. And that's where I get excited by it.
So I think it was nice to go after the Ungi channel. And everything they talked about building and telling a story. Everything is about stories, right? I think coming back to that data and that personalization, some stuff did presented at the PMSA. Anybody else geeky enough to know the PMSA? We started talking about getting a, thank you, Seth. It is the true data nerds of the industry, right? Using the data to understand from HCP to HCP based on who their audience was, so that messaging could be reframed and targeted. And I think we heard a bit about AI, and we will definitely talk about AI, is where that comes into play. Using that data to help understand what messaging is appropriate to which audience, and then how to build on that is where we're heading. We may not be there now, but.
Yeah, and I mean, like I said a couple of minutes ago, for us, personalization is, you can only really do personalization if you understand the information or educational needs of your target audience, be they healthcare professionals, be they consumers, be they caregivers, whatnot. And it's really about, the marketer or the agency taking advantage of all the available insights about the customer audience, using those in the most effective way to deliver a meaningful message that will resonate with your target audience in the channel that they are most wherever they are, whether they're online or in the field or whatnot, as soon as possible after they need that information. So yeah, I mean, as I said, we have no shortage of evidence that when you take that approach, your outcomes across like engagement, education, reach, and eventually scripts and diagnosis just are all like outperforming non-personalized type approaches.
Well, we've talked about it before. You mentioned daily data. So
Yeah.
a lot of us have daily data. We have medical claims on a daily basis. And when we start thinking oncology especially, treatment decisions aren't made in that moment of diagnosis anymore. Now you have a lot of genomic testing that's going out. So it's giving you that lag time between that diagnosis coming through and the decision being made. So it's not just about the personalization about what's being communicated, but when it's being communicated as well. So I think those are some of the further developments. And I agree with you. Not everybody's leveraging it. There's a lot more. The data sets that we have now, whether it's IQVIA or Medfuse, it's like the human brain. We're only using 10% of it if we're lucky. So I think for those of us that are a bit geeky, we're excited about what's coming in the future. We just need the agencies and brands to get on board with us.
Well, and I need the brands to get on board with having to create more content, right? But on that point though, is the content doesn't have to be completely dramatically different. If you have the same, what we talk about is like a 3-second wow. Like there is this consistent message that wherever you are on the journey, you have to be relaying about the benefits of the product and how it's going to deliver. But the way in and the way out can change subtly, and like that with the help of things like AI, which I know we're going to come on to, as long as you're thinking about it holistically, rather than just like sticking the two things together.
Let's step away from the data for a minute, right? Because we can talk about data, I think, for the rest of the day and all day, But
Some of
us, right? But besides the data, just getting away, like there's a lot of evolving technologies we're seeing in digital health, right? From the virtual primary care kits and all that. From what you're seeing out there, what has you the most excited, about what you see coming out in the future, and where you see like is going to have the biggest impact on shifting the needle towards health equity at a higher level, to conquer those social and health issues.
I think for me, where I see the biggest opportunity and I think the most exciting piece is how it all links together and we move away from a problem solution, I have an illness and I need a fix, to something that is more holistic and is taking into consideration mental aspects of how you're getting to the doctor or whatever these things are that come together. And that shift as we collect information with walking around or however it may be engaging there with there's even primary care providers who are now providing you with a wearable devices. Being able to bring that all together and focus the conversation in general wellness, I think is what I'm excited about seeing.
Yeah, and to me, I mean, health equity has a very formal, it has a CDC definition, right, which is something to the tune of, state where every human has access to the resources and the exact amount that they need it in order to achieve their optimal level of health. Which is, basically a way of saying everyone, we're giving equitable access to healthcare to all people. Now, behavioral insights, I believe, have a really, really great role to play here, right? So if you think about rare diseases, disproportionately affect minority communities. And getting to the point of even diagnosis, let alone treatment for a patient with a rare disease can take years. I was at a session recently where I described it as it was described as like the odyssey, the diagnosis odyssey. It can take 12 years to be diagnosed properly with a rare disease. And those those patients are being cycled through often, many, many different HCPs as well, and different specialties and whatnot. And I think the beauty of, the other thing to mention here is claims data it's not 100% coverage, right? We don't have, it's patchy, it's lagged, but the main thing is you're not getting all of the insights. So, in those rare diseases, it really is so much more critical to find every potential treatment HCP. So where behavioural insight come in is you can find those HCPs who are reading and researching around different symptoms, different adverse effects that might be associated with specific rare diseases, and complement the claims data, the clinical data, to reach out and find those HCPs and deliver those messages to them, that education to them. And that's what's so critical with rare diseases. It's about education and information. So to me, I care so much about rare diseases and the potential for the behavioural insights to kind of have a really positive impact on those patients who frequently see target lists being expanded by 25% when you're not just relying on claims data, you're adding in the behavioural. That's my
Let's dig deeper on that for a second, because the thing of rare disease is always the hardest part, and it is a very long journey.
Yeah.
Right, we're talking about the evolution of digital health, so we're talking about, we got telehealth now, we got virtual visits. Kevin, you mentioned, I think several of us here on the panel, I think all of us actually, maybe Eric or not, I don't know. So I think we're all wearing a smartwatch. A lot of us have a smartwatch, monitoring things, and there's, rings coming out and other technology. How do we think all this technology is going to speed up that whole rare disease treatment journey? Do you think there's a way to use this technology, instead of them having to fly across the country, and making it very hard to see these specialists for these rare diseases? Is telehealth and stuff going to speed it up?
Yeah, I'll jump in. I know this is your specialty of rare disease, but I don't think it's just rare disease. I think when we start looking at technology and feeding it back to data, it's going to be this cycle that brings in more data. And the only caveat I put to that is more data doesn't mean a better life. It means more complex life for those of us crunching it. We talk about no one has census, no one knows exactly how many medical claims there are in a year. IQVIA and Medfuse probably are the two top players with coverage, and neither one of us has 100%. But we're open source, and then you go to closed source, and now you have formulary bias in there. Now you add in all the continuous monitoring, the smartwatches, everything else that's going to come in. We're going to get more precise, but it's going to take partners that can help you get there. And I think that's going to be a big factor. AI will eventually get there from an analytics, but right now AI is strongest in the large language space, creating multiple contents, customizing that content, helping patients understand how to communicate with their physician. You talked about different groups in the social determinants of health. You have, I'll speak about the Hispanic because they spend so much time working there, the health education, that whole example of the Coke, it differs in how somebody communicates with their physician, and to bridge those gaps, that's where it will come in. So I think all of this is going to help when it's put in the right format, diagnose people faster and more accurately from the start, because you talk about that 12-year journey. I just recently did a patient journey study, and I've been doing some stuff on oncology. I looked at one 53-year-old diabetic male with end-stage renal disease. I thought I was going to be able to lay out their claims for a year on one slide. I got 3 months in and I ran out of space. In 2022, they had over 100 days claim dates with a physician. They had over 80 different ICD-10s coming through. It's a lot of data. But if we can get it into a distilled format, it will help the HCPs.
So,
Go ahead. I think you mentioned earlier on about oncology, and when I was working on oncology products for Pfizer 10 years ago now, I guess, the conversation then was around, well, cancer's now a rare disease because there are so many different things and so many types of treatments that we can have to think about it. And I think this is taking it to the next level, where I think everything is going to be a rare disease now, because we're going to have so many pieces of information that's going to help. There's only one of me, and if everything is going to be personalized specifically to who I am and how I think, then you could argue every condition is rare.
We heard earlier today in one of the conversations in this room about how we're seeing treatment journeys and diagnoses happening at younger ages. As people are going out, there's more testing, there's better testing. And then earlier before, Eric, you were talking about AI, and right now, there's a lot of data, and right now it's bigger, it works better in a big picture. But if we're thinking about AI and we're thinking about the future, when do you think, we have all this genomic data, we have all this lab results, if you had to put a number of years, when do you think AI is going to get to a point where it really is helping physicians, take this and really throw all this into machine learning and spit out a few things? Where Nicola, I think you got something there.
Yeah, we already are.
You already are?
Like AI is, we should just. Cameo.
Everybody wants to join the town.
Yeah, exactly. So excited. AI in healthcare is not new. And at IQVIA, we've been doing AI in healthcare for 20 years. It's definitely advanced a lot in the last few years. But it's not new. And we heard, you have to obviously caveat whenever we talk about AI. AI is only good as the data that it's being trained on. So it's about how you use the right data sets to ensure that you're training the models in the right way to actually give you, not what's the opposite of rubbish and rubbish out there. Good in, good out, yeah. Where was I going with that? So, an AI has, in my view, has demonstrated to have a huge potential applications in health equity specifically. Again, as long as you're training it on the right data sets. And we all know healthcare data, claims data is biased, it's inherently biased, right? It's based on patients who have managed to get care. They've managed to get into the healthcare system, be diagnosed, be treated, and then be longitudinally followed. So data sets that we have in the traditional healthcare space are inherently, we have to recognize they're not capturing the specific needs of underserved communities. But if we know that, then we can train the models better, we can interpret the outputs better, we can really get the most out of AI as a partner in supporting kind of our reach of health equity. One example that is probably like 5 years old now of how AI has driven health equity was we worked with a large healthcare system in Illinois. I've forgotten the name of it. It's public information, so I can get the link if anyone's interested. But we worked with them to we developed an AI model using natural language processing, or NLP for short, to analyze social determinants of health data. So I was going to also say, you mentioned earlier, claims data, genomics data is only really 30% of what determines our health. The rest of it, the 70%, is social determinants of health. And all of social determinants of health data is almost always captured in clinical notes in unstructured fields in disparate EMRs. So our AI NLP was basically reading all these clinical notes to capture the social determinants of health, and through that project we were able to drive more screening upstream of patients, more interventions earlier on, and overall, more prevention of conditions that were disproportionately affecting underserved communities. So just one example of how AI has been driving healthcare and health equity for years, but one that is particularly exciting because it's about kind of population health and addressing health equity. So yeah, sorry.
No,
I'm really monopolize that one.
No, that's a great one. Eric, did you have something to add? I thought.
No, I take the side when I go back to the first part of your question, like what's the timing? Everything is moving so quickly that it's really hard to guess. We're definitely only at the tip of the iceberg. There's a lot more to go with where AI can take us. And at the end of the day, what comes to mind when you talk about what goes in, quality of what goes in, we do have to always remember that the data starts with human input. All data starts with human input. So there's certain bias in there. I was just working on some ICD-10s, and I said to somebody, yeah, that's not a billable code, and we ran the report, and of course there were claims for that non-billable code that came through. Data is dirty, and I think that's where I think the first step for AI is to help clean some of that up. Doing the large language and searching through what used to be the chart reviews, which is messiest of all data, is probably another early stage. Where I really think it eventually, from a marketer standpoint, comes back to taking this information and having the ability to create customized content and reframing that content, going back to the language thing. And another example I had was my daughter's a ski racer, and we were at the top week before the start, and I heard two other girls that had been on the radio talking to the coach. And they get off the radio, and she said, "Oh, he just used whatever word. He's like 50. I don't think he knows what that word means." Right? And it really, that hurt, because...
That was about you.
Yeah, that hurt. Yeah, I wasn't the coach. But I think it's that whole context of where can AI help us. It can help us really create that content that means the most to that individual.
I also think from like a creation of the content perspective, it can really help my creative co-workers and the other agency folks out there to focus on what they do best, which is defining what that message is, not creating 100 different sizes of an ad with a different color, like call to action. I think we can be more efficient at creating the type of content and do it in a way that can help us.
So we're almost out of time. I want to wrap it up with some final thoughts. Right? We're talking about a lot about health equity, a lot about social determinants and health. And as more privileged folks up here on the panel than those people who are struggling to find care or often forgot, what can we do as allies to help accelerate and change the paradigm to move the health equity needle in a positive direction?
So firstly, we should look to our own organisations and employers and ensure that we are creating spaces for everyone to feel comfortable and thrive in their own employer organisations. I think that's the first thing that we can all do, and then from a serving from a marketing perspective, I would say it's really ensuring that between us as marketers, whether we're brands or agencies or publishers or whatnot, that we're really being thoughtful about the data sources that are being used, being acknowledged, aware of any biases, inherent biases in data that we're using, or AI models that we're training on that data, that we're delivering messaging and content to the places that our target audiences are going to be, whether that's social media, whether that's like endemic website properties, and that we are continuously measuring and optimizing all of our tactics and channels to ensure that we are constantly being thoughtful about, are we addressing, are we reaching the right audience, are we delivering a resonant message, are we trusted?
Yeah.
So yeah.
Just in like 10 seconds or less.
I think we have to be honest.
Yes, we're running
I
out
think to
of
be
time.
honest and recognize what you don't know and go find the people who know.
Eric, final thoughts?
Look for it, right? It's so easy. If we look at the data at a national level, everything else is going to wash out. We've got to segment down, look at them, break it down, segment your data, because that's where your ethnic, racial groups will pop out. That's where your economic groups will pop out. Your educational differences will pop out. We just look at the top line. We're still a population that's 70+% white. You're going to miss everybody else.
All right, well, thank you guys, much appreciated.